Good afternoon, everyone. Thanks for joining this Street Child webinar on our COVID-19 emergency response in Uganda. We're going to be hearing from a fantastic panel of speakers today, including George Luanga, our area manager in Masindi, Henry Moyanja, our Uganda program manager, Ellen Fitton, our Uganda country representative, and we're very much hoping, although she's having a few technical challenges, that Rita Nansareko, the executive director of our partner on the ground, AWAD, African Women for Youth Action and Development, will be joining us too. The format for this webinar is that we will be setting out the emergency response through a series of questions to our panel over about 30 minutes, and then we'll open up for questions over about 15 minutes at the end. All questions can be typed into the Q&A, and I will try and get through as many of them as I can. So for those of you who don't know me, I'm Megan. I'm the Head of Africa Programs for Street Child, and I wanted to start by briefly framing Street Child's global response to the humanitarian disaster that is unfolding across the 14 countries in which we work as a result of the COVID-19 pandemic. There's no question that this crisis will hit the poorest and most vulnerable hardest, and Street Child has taken the decision to lean in rather than out and respond as quickly and as effectively as possible through a 4-pillar response plan. So our first response priority is and has to be prevention. COVID-19 cases are rising across all our contexts, and there's no reason to think that they won't get to the level that we're seeing across the countries that many of us are based in. And we know from the Ebola epidemic experience that we have that it's essential. The first priority is to help vulnerable communities get the key information and sanitation supplies they need to keep as safe as possible, and to help local leaders strategize how to stop the spread of COVID-19 in their local communities to support the wider government responses. The second is preparedness. We are acutely aware that this health crisis is just the beginning. The indirect humanitarian impact of COVID-19 on the poorest, who have the least access to food, cash, and basic services, will be huge. So whilst raising awareness, we're also collecting information from the ground up about the needs that are becoming most urgent and emerging. And we're going to hear a bit more from the team about how some of those needs are already materialising. Thirdly, we're prioritising humanitarian response. For some, this crisis has already arrived. And so we're responding across our main sectors, our historic sectors that Street Child normally works in, of child protection, education and livelihoods. And you're going to hear some more detail about the kinds of activities that we're doing in Uganda specifically. And finally, building local capacity to respond. You know, Street Child knows that our network of 44 local actors on the ground and 6 in Uganda are of their community in the field. They are best placed to respond, especially now when the international community is practically paralysed, which is why we're working side by side with our partner network to do more and faster. And through this 4-pillar response plan, Street Child's aiming to reach 1 million people by the 31st of May 2020, including, of course, in Uganda. And at this point, I'd like to hand over to our first panelist, Ellen, who's our country representative, to talk a little bit more about the situation that Uganda is currently facing. Over to you, Ellen.
Hi, everyone. I wanted to start this webinar just by making some comparisons between the UK and Uganda. And not just the UK, really, looking at various parts of Europe, America, Asia, all that have been hit very hard by the COVID crisis already. We've obviously seen a huge number of deaths of loved ones and huge strains on the economy. But this has all happened in countries like the UK, where we have a national health system that provides free healthcare for everyone. We have a government who are willing to help businesses and individuals who are really struggling. And we have the ability to put in the necessary prevention methods to prevent the spread of the disease, such as social distancing and hygiene practices. Uganda, unfortunately, isn't that lucky. And although at the moment there are only 61 confirmed cases, we believe there are a lot more. And it's a very scary time for Uganda. Uganda does not have free healthcare, and currently there are only 54 intensive care beds for a population of 44 million. So many people live hand to mouth, and already 3 weeks of lockdown has led to huge levels of starvation. And really, we've seen a huge number of negative coping mechanisms being put in place, such as child labour, early marriages, etc. On top of this, there are also many conspiracy theories and myths surrounding the virus, which makes it really difficult to help prepare communities on how to prevent the spread of the virus. And then the luxury of some of the prevention methods that we've been able to put in place. Social distancing just isn't a thing in a lot of places where street child works. If you take the refugee settlements in the north, hundreds of families share latrines, share the same water point, and families live very close together, so they just do not have the luxury of social distancing. The same with the necessary hygiene practices. In many places, running water just isn't that available, nor is soap. So making sure these prevention methods are in place has been really difficult. So although at the moment the number of cases in Uganda may seem really low, what I'm hoping the team will help show you is the socio-economic effects so far are already huge. And we know that the communities that we work with are the ones that are going to be hit the hardest because they're already the most vulnerable and the most marginalized. So the team are now going to answer a few questions from Megan, who is our host. And then if you have any questions, please do let us know.
Thanks very much, Ellen. And just to say to all participants, it would be great if you're able to turn on your camera. We've had a request as well from those who also rely on lip reading to help them understand the content. So if all panelists could unmute themselves and turn their camera on when it's their point to speak, that would be fantastic. So I'd like to pass to Rita next to seek some ground level perspectives as our partner's executive director. And Rita, I want to ask you, what measures have taken place at a national level in Uganda to date to prevent the spread of COVID-19, and what has the impact been on everyday life?
So Megan, Uganda has taken up different measures to prevent the spread of COVID-19, and the major ones being enforcing of the lockdown, like Elena said, and the curfew. These have greatly impacted on everyday lives of the people in various ways, and the first one being the closure of schools. This has exposed children, especially girls in refugee communities and rural areas, to sexual abuse, since schools have been working as a safe space for them. The lockdown has also stopped learning of children since schools are closed. The situation has led to complete closure of businesses in Uganda, and the population is uncertain of what to feed on the household members, and also they lack income to meet the basic needs like health and others. The closure of businesses has a big percentage of Ugandans left unemployed, especially the casual laborers who feed from hand to mouth.
Thanks very much, Rita. And apologies, I'm afraid that if we turn on the cameras in Uganda, it will slow down the bandwidth too much. So Rita wasn't able to share her camera, but we'll try on our side very much. George, I want to come to you next to share your perspectives from your work in the Masindi area as to what impact these measures have had on the communities that we work with and what their greatest needs are at the moment.
Good afternoon, everyone. In the Masindi area, we work in Chiriandongo and Oyam, and we have seen the lockdown has impacted on schools that have been closed, and there's no learning for children at all, especially for the candidate classes that are going to sit their national exams at the end of the year. The schools have also been sources of food, especially lunch for children, and this is not happening. So we have fears that children face starvation. Also in the communities, there's inability to access utility services like hospitals or antenatal care for young mothers. This has been reported by young mothers on our Young Mothers and Youth project. Also, limited access to markets for food, but also for business. And the young mothers who are in village and savings associations, as well as the youth, the youth that we work with, have faced a challenge of accessing their savings and credit, especially among the village banks that they work with, or the formal institutions that they work with. So this has limited the work that they do. We have also seen a loss of livelihoods among the people that we work with, the young mothers and the youth, and because they can't go to their farms, there has been a complete halt to their small businesses, their micro businesses, who, especially if they get daily income selling cereals, fruits and vegetables, but also a lack of access to capital to finance their businesses. So this is in one way led to the loss of business, but also to the access to food, which could lead to some to a level of starvation in the areas where we work. Thank you.
Thanks, George, for that frank assessment. I want to come to Rita next, because one of the key concerns raised throughout our emergency response by our supporters is how is it possible to implement social distancing in refugee camps? And I know Ellen alluded to it as well in her introduction. Rita, can you give us a bit more insight into how this is working in practice on the ground? What is possible?
Thank you. In Uganda, people are used to socialization, and while there is emphasis on social distancing, this can hardly be achieved and applied in communities like refugee settlements and rural areas, where people highly depend on shared resources and facilities like latrines, water sources, and others. So we realized that there was urgent need for us to intervene and offer sensitizing messages in the communities and the refugee settlements, telling them about how dangerous COVID-19 is so that they can move from the normal practices and at least apply some measures that can mitigate the rapid spread of the disease. Otherwise, the challenges related to some cultural norms and religious practices are greatly holding us back, because it's hard to change them until when we realize that we had to push the message on and on and on. Yes.
Thanks, Rita, for that. And I think we can reflect that during Ebola, the impossible soon became possible. Reducing social contact and stopping simple greetings was one of the hardest but most effective ways of people stopping unnecessary social contact that was at least possible, even in the most crowded of contexts. I'd like to bring in Henry now, our Uganda Programme Manager. And Henry, I want to ask, what do you see being the long-term impact of the COVID-19 crisis? You know, let's say once lockdown has been lifted and life returns to something more normal. Henry, you're still on mute.
Oh, sorry. Hi, everyone.
Hi, we can hear you.
Okay. Hi, everyone. I think we've already seen an global economic crisis and issues in Uganda. Definitely, we're already seeing economic issues such as livelihood, where people's livelihood, they've had to spend their savings that they've saved, families that they had saved in the previous couple of years or weeks, during this lockdown period. But we've also seen businesses failing already, and most of the other people, people have already lost jobs. On that, children's education has been disrupted, where kids have been, off for a month and a couple of weeks. So there's been any learning going on, especially in the areas where we operate. We're seeing people undertaking negative coping mechanisms. And even in the communities, we've already, we're seeing already child labor and child marriages that we think might be a result, for people, might be a route which people may take just in order to survive, but also there's lots of fear and conspiracy theories that might long last. So this is all, this is what we think that we have seen that may happen after the lockdown has been lifted.
Thanks, Henry. It'd be interesting to hear more now about interventions, the activities that the teams have been doing in their respective areas to respond. And it'd be great if perhaps all of our panel can briefly respond to this one. So let's start with you, George. Tell us more about what your teams have been working on in relation to the COVID-19 emergency response.
Due to the lockdown, a lot of our work had stopped, but we have gone back to work, and we want to give our young mothers and the children that we support a sense of normalcy. So we have developed home learning kits for them, home learning kits where they can continue to learn from home, especially for their literacy and numeracy lessons. We have also taken up on prevention and awareness campaigns using telephone messages and also radio messages to the communities. We have also taken an option of teaching young mothers safe hand washing practices through the visits we make, and also teaching them on the issues of social distancing. We have also gone on to support the district local governments with protective gears such as masks, gloves, and sanitizer. So this is really making a difference in the communities.
Thanks very much, George. And I just want to take this opportunity to encourage everybody to ask questions as we go. The panel here are obviously working hard out there in the field, and it's an amazing and hopefully great opportunity for you guys to ask questions directly. So do please type away with your questions. I want to direct the same question about what activities your teams have been working on the ground to Rita and Awad. Perhaps you can tell us what you've been prioritising.
As Awad, we are using our existing community leadership structures in the community, both in the rural communities and the refugee settlements, to refer to as immediate needs of the communities. Because of the social distancing, we are unable to go as a group to meet our people of concern. Because of the lockdown, there is an increase in gender-based violence and child protection cases within the communities that we serve. We are therefore working to ensure that cases that arise from the communities are urgently addressed and responded to mitigate further harm to survivors and ensure that children are protected at all times during the lockdown. We also distributed some personal protective equipment to the frontliners in the communities to make sure that they are safe as they work on the information desks that receive cases.
Thanks very much, Rita. And then finally coming to you, Henry, if you'd like to talk a little bit from your own perspective about what your team has been prioritising and focusing on in terms of COVID-19 response activities?
As a street child, Uganda being an informal sector, and people relying on everyday income, we've been in the areas where we operate, we've seen people going hungry and starving due to the lockdowns. So we as Street Child came in and intervened to give relief to the most vulnerable households by providing food packages, so that to help with the best, like food, water, for them to be able, to also to help them with the social support, so that they do not get trauma and all that, get the basic, which is food. And that's both to the parents and to the children.
Thanks, Henry. Okay, so finally to the panel, I know the teams have been hearing an enormous amount from the communities we work with during this early response phase. For many of them, we are the link to basic services. George, I believe you had a message from your area communities that you wanted to share with us today. Would you like to pass on any messages to the team and the participants?
The message and the voices that are coming out from the beneficiaries and the people we're working with in the rural areas in Kirandongo and Oyam seem to go towards the rebuilding of businesses and income avenues for the people, because at this point many of them have lost businesses, or their businesses are slow, and much of their capital base has been eaten up, especially buying home utilities and food. So they want to see support towards rebuilding their incomes and businesses and farms, so that probably after the pandemic, they can get back to life as usual. So that is the key call and voice that is coming out from the communities.
Thanks very much, George, and to all our panelists across the Uganda team for setting out the challenges and some of the fantastic work you've been doing to respond on the ground. Ellen, I'd like to round up this section by hearing a little bit more about what you as the country representative for Street Child see as the priorities for Uganda's COVID-19 emergency response going forwards, before we pass the questions. And please, participants, do pose any questions either privately to me or in the Q&A. Thank you.
Thanks, Megan. So I think, as the team have really highlighted here, already COVID-19 has had a huge socio-economic impact in Uganda. As they alluded to, schools have closed, which means no learning is happening. Families are struggling. They are struggling with livelihoods, and we've seen huge cases of starvation. We've seen the inability to access the necessary hygiene measures that are needed to prevent the spread of this virus, and then equally, as we've talked about, the difficulties in implementing some of the prevention methods like social distancing. As Rita alluded to, we've seen a huge number of increase in child protection cases being reported, and lots of negative coping mechanisms such as child marriage and child labour increasing. So already Street Child Uganda and Build Africa are responding. As George and Henry and Rita have said, we are educating the community about this virus. We are helping dispel some of those myths and conspiracy theories that exist at the moment. And we are helping prepare the community. We're helping them establish hand washing facilities, providing them with soap, and really getting them ready for if this virus does spread across the country. We are providing emergency food kits, as Henry mentioned, and we're really helping identify those children who are highly at risk of protection, well-being, and starvation risk. But there's so much more we can do and we want to do and we're ready to do. So the team and I have just finished numerous meetings this week about how we really want to help the most vulnerable access and education during this time. The government of Uganda are rolling out a radio and distance learning program as of next week. And although this is fantastic news, one of our biggest concerns is most of our beneficiaries will not have access to a radio, and they won't have access to these kits. And if they do, they may not have literate parents that can help them complete these kits. And so what we really want to do is design a pack that targets these children, because otherwise the inequality is going to be huge, and you're going to have some children that are able to continue with their education and others that aren't. We have touched on the issue of starvation. We've been able to provide some emergency food packages, but we have seen there is a huge need for more. I got off the phone yesterday from one of our other local partners who was telling me that in Kampala, some of the urban refugees have been forced to eat pet dogs and cats because they have run out of food, which is just totally unacceptable. And we would love to be able to provide them with emergency food kits to get them back up and running. And then finally, we need to do so much more on the prevention side. We want to establish more hand washing buckets. We want to provide more soap, and we really need to continue with the education side of things. We've only just started, and there's so many more communities that we'd like to reach out to. So we're asking all of you to help us do so.
Thanks very much, Ellen. And thank you as well to the participants who have sent in some questions, which I'm going to take us through now and direct them to different members of the panelists. So building on that absolutely horrendous example that Ellen just shared, we had a question which I'd like to direct to Henry about whether the lack of access to food is due to the lack of money to pay for food due to employment, or the lack of supply of food because farmers aren't able to produce or transport it, or another reason. Henry, are you able to shed a bit of light on what's causing that challenge?
Sorry, say that again, Megan.
Okay, so the question was: is the lack of access to food due to the lack of money to pay for food due to unemployment, or lack of supply of food because farmers aren't able to transport it, or some other reason? Can you help us understand why there are such hunger challenges?
The challenge is really lack of money. As we all know, Uganda is being an informal sector and activities, and most people rely on the everyday income. So people do not now that with the lockdown, so people do not have access to their work, day-to-day work where they go and they're paid on a daily basis. So people do not have income. And, with people here live on hand to mouth. So that was all, have been affected. So the supply of food is there, which the government is supporting, and farmers are continuing to supply food. But if the access to, resources to buy the food, to purchase the food.
Thanks very much, Henry. Another question which I'd like to direct to Rita relates to specifically education and schools. In the UK, the government has cancelled all exams and teachers have had to work by issuing predicted grades to award the students for their final exams. Is this something that the Ugandan government is doing? How is the Ugandan government treating the situation of schools and the situation of exams? If Rita, you could take that one first, that would be great.
Thank you, Megan. Yes, the Ministry of Education from Uganda made a communication that this term children are not going to sit for exams, and next term, which is supposed to be for mock, it will only offer mocks that are designed internally. Most of the time is now designed to catch up classes and lessons.
Thanks very much, Rita. A question to Ellen. This is around long-term planning, noting that there's much to learn and has been learned from Europe and the US. And this participant wanted to know, have Street Child considered wider contingency planning, and indeed what projects might look like post-COVID, along the lines of exit strategy?
Yeah, we have done, we had a big discussion about this actually this week. One thing at the moment, obviously, we're focusing on the here and now, and we're looking at how to prepare the communities for the virus. But there have been conversations about how we'll help the communities recover. And Street Child is very lucky that we have a family business for education model that we have implemented in numerous countries. And we were just about to start implementing it in Uganda before the COVID crisis. So we do have this vision that when things start to recover and we're able to work with these families again, we will help them rebuild their livelihoods. We saw this being a huge issue during Ebola, and we were able to implement this model, which had a huge impact on families and really helped them to recover. So we are looking at that from a kind of individual point of view. Obviously, we're worried more from a national point of view. Uganda's what will happen to Uganda's economy, particularly tourism, which has just started to get underway, etc. But yes, we are looking at the longer term plan and have some ideas.
Thanks very much, Ellen. I'm going to direct the next question to George. And this is more about the practicalities of COVID-19 response. The question was, how is the Street Child team getting out into the field to work with beneficiaries given the lockdown and social distancing measures? Some beneficiary areas, for example, may not be suitable for social distancing, such as some surrounding Kampala. George, can you comment a little bit on how the Street Child team is getting out into the field to work with beneficiaries, despite the measures?
Despite the measures, the teams on the ground are working remotely, but because we have an institutional structure where we have community-based trainers, we are working on the phone with them. We are working online with them using communication platforms like WhatsApp, because some of our community-based staff and can have access to internet and modest smartphones. So we are working in this way, but also we have also encouraged some of our field staff to practice and teach communities on social distancing, especially when they move around, sharing messages, giving them leaflets on prevention and response if they have any issues. And this going forward will be the way to work until we have a situation where everything is back to normal.
Thanks for that, George. My next question is going to be directed towards Henry, who talked on the panel about a little about the long-term impact of COVID-19. And Henry, we've got a question. How big do you think the long-term impact of this crisis will be? In 50 years' time, say, do you think Uganda will still be feeling the effects of this? Henry, if you could answer that one.
Yes, definitely, because everything is going to slow down at the moment. And definitely, I would say if we had moved 10 steps in front, I would say with this situation for now, if it goes on, let's say we don't know till when, but it goes on for the next 6 months, we would, to me, it looks like on the economy, we would move another, again, like maybe probably 10 steps backwards. So lots of business will close and there will be an issue of unemployment. Then families, of course, in the rural areas, the education will be affected. We will even see less funding coming in from the donors who provide us aid that will affect all, the sector, most especially education and health. I think that's, but definitely in the next 50 years,
Thanks, Henry. The next question I've got, I'm going to direct to Ellen, and whether you think that Street Child's experience with Ebola and the communities in Africa's memories and experiences of that is helping the response to COVID-19.
Yeah, I definitely think it is. I think a lot of I was actually in Sierra Leone in 2015, and I think a lot of what we're doing now is things that we saw that worked very well during Ebola. For example, our model of prevention workers. When Ebola struck Sierra Leone and Liberia, we mobilized our teachers and teaching assistants in the rural communities to really help educate these rural communities about the disease. And that's something we're replicating now, because we've seen, as a result of all the myths and conspiracy theories around COVID, actually the community members are the best ones to do this education. Communities are very fearful of outsiders coming in, and there's been lots of horror stories surrounding that. So we are really using our community connections and our local partners to help us respond. And it's exactly like I was saying when it comes to the family business for education model. We obviously used that after the Ebola crisis, and we saw huge recovery from a lot of our families, and we're hoping that the same will happen after the COVID-19 crisis.
Thanks very much, Ellen. So next question I want to direct to Rita, which is that in the UK and other countries, temporary hospitals have been built to help meet demands with COVID patients. Is this possible to happen in Uganda? Is it happening at all? How is Uganda planning to cope with an increase in patients, if at all?
Thank you, Megan. Currently, Uganda has not yet established hospitals for response to COVID-19. However, isolation centers have been established with temporary structures, and most of the funds that we have are directed towards food for the vulnerable people, treatment, and also buying testing kits.
Thanks very much, Rita. Okay, I've got a couple more questions, and then I suggest we start to wrap up. One question I wanted to direct back to Ellen. Do you think there will be a rise of speed schools or accelerated learning programs in order to combat the gap between those who've had access during COVID-19 to the school packs, for example, and those who've been forced into child labour, for example?
I think it will be needed. Whether I think it will actually be put in place in practice, I am unsure of. Obviously, with the refugee situation anyway in Uganda, there are over 1.3 million refugees in Uganda. We're already using methods such as bridging or speed schools or accelerated learning. We've only just started touching on the need for the refugee settlement, and now this crisis has obviously come. So I'm not convinced that there will be the funding or ability to help implement more of these programs across the country. I think, in a way, Uganda is slightly luckier than some countries like the UK at the moment because of the way that our term runs. So term runs from January to December. So at the moment, we're not at such a critical stage when it comes to exams. So we're hoping, as an organisation at Street Child, we're hoping we can put in catch-up classes and after-school classes so that we can help catch the children up and get them back on course for the curriculum. But to be honest, I think it just really depends on how long schools are closed for. If they're closed for, as the ministers have said, for the next 3 weeks and then they reopen, we will be able to catch up. But if it's anything like Ebola, when they were closed for 9 months, you're looking at children having to potentially repeat whole years to catch up. And there will have to be lots of accelerated education interventions in place to really help propel that forward.
Thanks, Ellen. Okay, so final question for our session today, and I'm going to direct this one to Rita again. So experts have highlighted that really it's the elderly most at risk of COVID-19 and suggested that the death toll may be significantly lower in developing countries that have a younger age profile, like Uganda, for example. Lockdown is obviously causing some horrendous issues in Uganda, and the participant wanted to know whether you feel it is correct for the Ugandan government and governments in Africa to have responded in the same way as in countries with much older populations. It'd be great to get your insight on that, and to be honest, any of the other panel members who may wish to respond as well after Rita.
Thank you, Megan. True, Uganda is one of the countries that have the biggest population of young people below 30 years of age. And I think the response needed to Uganda has to be designed in a way that is applicable to our context. The lockdown and the COVID-19 consequences are going to muchly affect economic growth of the country. And we realize that already our government is struggling to respond with the burden of the loan, which is also being doubled to the already existing loan. And small businessmen are borrowing to resettle to get up their businesses again. I think we have to have a model that is directly responding to our context.
Megan, if I can just add to that, I think one of the issues that we are seeing in Uganda is obviously we've seen that if you have pre-existing health conditions, you're at increased risk. And Uganda has a very high level of diabetes, HIV, malnourishment. So I think that is a huge worry for us, is yes, maybe they don't have the age issue as much because they are a young population, but we do have these pre-existing conditions that could really make people extremely vulnerable to COVID.
Thanks very much. Okay, well that's as done for today. Thank you very much to our panelists, Rita, Henry and George joining us from Uganda, and to Ellen as well, and to all our webinar attendees today. We're so grateful for your interest and support. You've heard today some of the various serious challenges that Uganda is facing, but also how we at Street Child are thinking about and responding to help the most vulnerable communities get the support they need at this incredibly testing time. We're holding a series of webinars over the coming weeks on the evolution of our response and how you can help. So do keep in touch for more information. Any questions or anything you want to engage the team on, please do reach out. We're here, we're available. And just to say, stay safe and have a nice evening, everyone. Thanks. Bye.
Thank you, everyone.
Thank you. Thank you so much.